1999, we started our first remote area clinic in Shaiba, Rubal Khali. It has been a challenging terrain there, not just because of the distance, but the nearest health facility for any referrals or any kind of other management was almost more than 800 kilometers. We got our first approval to run remote area clinics, especially for oil gas sector, be it for Aramco or any other multinational company in 2011. As of late, we are running about 40 clinics around the kingdom with our 24 hours command center, which is based in Faraby Medical Center, Tama. How we start the clinic in a remote area goes this way. First of all, of course, we have to make sure that the staff who's assigned to work in a remote area are not just certified and qualified to work, but psychologically they have to be ready for running a clinic which is manned by only a doctor, a nurse, and with an ambulance driver. So the certifications and the regular follow-up trainings which have to be done before the staff is mobilized to the site. Coming back to the placement of medical equipments, consumables, and pharmacy drugs, we have a policy which is followed as per the international standards and the Ministry of Health policies. We have a very strong documentation process, not just for documenting the day-to-day activities as well as for other activities for following the policies, procedures of the company where we are assigned to work with, as well as to make sure that the international standards are followed, be it Sibahi or for Ministry of Health. Now the other most important aspect to run a remote area is the emergency response plan for triaging or in case of a mass casualty. What we tend to do is we have an emergency response plan initially for the primary care, secondary care and tertiary care, which is partly incorporated with the main emergency response plan of the company where we are assigned to work in. This has been regularly audited by a group of experts who are based in Dammam. We have a biannual auditing process and we make sure some of the gap analysis issues which are kept open have to be sorted out immediately, be it with Faraby Group or with the client which we are with. Faraby Medical Center, apart from running remote areas and providing healthcare services for the people working in industrial area clinics, we offer what is known as occupational health assessment programs for all our clients in industrial area oil gas sectors as well as for our customers based in Dammam, Doha and industrial area. What we do is we have an extensively trained staff who know exactly what occupational health, and we follow the UK standards which is known as OG UK, and we follow the US standards which is OSHA and NIOSH standards. So we incorporate that standards into in our Faraby facility. We have very well qualified staff, be it the ENT surgeons, the pre-placement examination for audiometry or spirometry. We have a very smooth process. Once an employee comes to our medical center, there's a process in place and which is meticulously followed. Employee sees the doctor first, goes to the X-ray room, finishes his lab, and in a very short period of time, which is very important for us, make sure that all the process is completed. We have a state-of-art laboratory which is regularly monitored by Ministry of Health, and we make sure that the reports whatsoever so generated meets the international standards. Now we have what is known as, apart from occupational health, we do what is known as risk assessment for our employees working in oil gas sectors. We make sure that before we give them the advice as to what exactly is the medical evaluation is to be done for any individual, we check the risk assessment of the particular company as to what exactly they're exposed to, be it chemicals or be it any materials which they are in direct contact, and we make up a plan which suits that particular individual following the international standards.
Faraby Healthcare Solutions is a leading healthcare provider in occupational health services and on-site medical operation. We have extensive experience since more than 26 years. We provide our services to oil and gas, construction, and industrial sectors. Faraby Healthcare Solutions is a pioneer in receiving Johns Hopkins Aramco healthcare approval since 2011 to offer remote area clinic services within Saudi Aramco projects. Faraby Healthcare Solutions provides several services such as on-site and remote medical operation, occupational health checkups and programs, and patient transfers and medevac, as well as supply of medicine, medical consumables, and equipment. In addition, we provide professional healthcare advisory services, and specialized medical and emergency training. Faraby Healthcare Solutions recently formed a new strategic partnership with Med-Evasan Company, a leading medical assistance and repatriation service provider based in France. This partnership will expand our services to include international Medivac and medical assistance call center services, internationally and locally, as well as provide telemedicine and second opinion consultation with leading European physicians. Faraby Healthcare Solutions is working on introducing new occupational health services that focuses on mental health and well-being of workforce.
We're looking forward to expand our services in different cities in Saudi Arabia, and we are putting our financial plan to improve our human resources assets as well as the logistics. We assigned a budget in the information technology and in the healthcare solutions and services. Every member of the Faraby group is focusing on giving the best health services to our clients and to our patients. In the end, we always aim to be your healthcare partner and to create a healthy workplace